Thank you very much and good afternoon. So today I want to talk a little bit about what's happening right now. No surprise to people, we continue to see high rates of virus transmission across British Columbia, and this is anticipated to continue for the next few weeks. I think we're getting the sense that we have leveled off somewhat, and if we look at what we're seeing in other jurisdictions that have been ahead of us in terms of this wave around Canada and around the world, we may be entering soon into the place where we will see a decline. But right now, our primary focus needs to be on keeping as much as possible open in our communities and ensuring that we have that balance, that our healthcare system is not getting overwhelmed as stretched as it is. As we know, hospitalizations are going up, and hospitalizations come after our infections start to rise. It's a lagging indicator. Many of the people in hospital have a Delta variant. Some of them have been there for some time, but we still don't know the full effect that Omicron and the rates of hospitalization that we're seeing now are going to have on our healthcare system and the level of care that's going to be required in the coming weeks. Later this month as well, we anticipate that we'll have additional treatment options that will be available in BC, and we're preparing for that as well. As we've talked about before, there's a number of new antiviral medications, particularly Paxlovid, also molnupiravir, that are under review by Health Canada, and we're hopeful that those will be available. Another important tool to help us keep people out of hospital who are at risk of having severe illness with COVID-19. What this means in the short term is that the restrictions on gatherings and events are likely to remain unchanged for now. And in parallel, we are looking at what we can safely resume now that all businesses have COVID safety plans, starting to put those back in place again too. And later this week, we'll be providing an update on the modeling data and on more detailed information about who is at risk in hospitals. What we're also seeing right now is a changing risk scenario, where the risks for those who are vaccinated is very different, even with this strain of Omicron, from those who are unvaccinated. And I've talked, since we've discovered this new variant, Omicron, about putting together the pictures of the puzzle, the pieces of the puzzle, to get a full picture of how it's affecting us. And one of the things that is becoming very, very clear is that this strain of the virus is absolutely mostly mild in people who have the protection that vaccination offers. But if you are unvaccinated, you don't have that protection, and your personal risk has gone up dramatically in some communities. You are also at higher risk, if not having that priming of your immune system, at higher risk having severe illness and ending up in hospital. And we're seeing that here in BC. We're seeing that in countries around the world. The majority of hospitalizations, and in particular the majority of people who are in our ICUs needing critical care right now, continue to be people who don't have that protection that vaccination gives by priming our immune system. And the way the virus is spreading right now, people who don't have that additional protection don't also have the same protection from reduced transmission through community immunity, that halo protection from everybody else being vaccinated. And this is one of the challenges that we're facing right now with Omicron, because people who are vaccinated do have good protection, good strong protection against hospitalization and severe illness, but we are getting infected at a much higher rate. And we see that in the numbers that we see every day, where the numbers of cases, the percent who are positive, reflect the percent of vaccinated people in the community. So if you are vaccinated, we now know with Omicron, yes, you do have a potential to contract the virus. This decreases with the booster dose, so that's good news, by about 50%. So it doesn't take it down to zero like it did with a number of the other variants that we see, but it does reduce it. But the risk has increased with this new Omicron variant, and the likelihood of severe illness, though, and hospitalization remains very, very low. So the new data that we've seen, and we were talking about this in my federal group this morning, about 60 to 70% less likely to need hospital care for people who have 2 doses of vaccine. You're 60 to 70% less likely to need hospital care up to 6 months after you've received your dose 2. So that's great. That really is important right now with this variant, even though it's probably milder in overall. That protection against hospitalization is critical with the very high numbers of transmissions we're seeing right now. And that protection from hospitalization, severe illness, and death increases once again back up to the high 80s to 90% after that 3rd or booster dose. So yes, vaccinated people are becoming infected, and the percent of vaccinated cases reflects that. But they're much, much less likely to need hospital care, ICU care, or to die from COVID. And the number of people in hospital, and we see that in our issues bulletin that we put out every day, that number of people is increasing in the vaccinated. But we have to remember that's because the vast majority of people in BC are vaccinated. So the risk, though, is much, much lower once you're vaccinated. So as of yesterday, for example, the age-adjusted risk if you were unvaccinated was about 35 per 100,000 people. And those who are vaccinated, it dropped down dramatically to 4 per 100,000. So those are the things that we need to look at now to see what we're, to understand risk on a personal level and on a community level. We're also seeing data from Denmark in particular, some really good studies, but also the UK, that shows that vaccinated people are less likely to transmit Omicron to their household contacts, the people they're closest to. And we see that people with even 2 doses of vaccine are less likely to transmit, and you have that booster dose, that goes down even further. That's really important. So the sum of it really is, if you are vaccinated, you have less risk of infection, particularly after your booster. You're much more likely to have mild illness, to not need hospital care, to not need ICU care, and to not die from this virus. And the risk that you're going to pass it on to others is dramatically reduced compared to people who don't have that protection. Last week, I spoke about the requirements for businesses to reactivate those COVID safety plans that helped us get through these last few waves of COVID. And I want to thank WorkSafe and the industry partners that we've been meeting with over the past week. For this is an important tool. It is modified. It's modified to deal with the situation that we're in right now and to recognize the importance of the workforce being vaccinated as a way to protect our businesses and keep them open and keep them going, but also to look at things that are no longer needed in this context that we're in now. So rather than having capacity limits, for example, looking at where in a business or an organization or a retail outlet you see choke points, for example, and being able to develop a plan that makes sure that we alleviate those rather than relying on the blunt measure of things like capacity limits. So these are important tools, but today I also want to speak about, in the context, the risk context that I just talked about, the importance of each of us also thinking about our own personal COVID safety plans to get through this wave of Omicron. It's about doing our own personal risk assessment, determining what is safer for us right now and what should be paused for this period of time when we know there's a lot of transmission happening around us, so that we can continue to do those critical things like going to work and ensuring our children can continue to go to school. So first, we need to consider things like age. We know that even with booster doses, we're at higher risk the older we are, and we saw that in breakthrough cases in people who are over 70 and over 80 and over 90, and still right now We have people in critical care in their 70s, 80s, and 90s who don't have the protection of vaccines. It is incredibly important. It's a small number of people, but I think I can appeal to you now more than ever. It's very important that you get that protection. If you spend a lot of time with those who are older or with family members who are immune compromised or going through treatments like cancer treatments, you need to take additional precautions in other aspects of your life. Think about your own health profile. If you also have an underlying health condition or clinically extremely vulnerable, we still need to have those protections right now as we get through this wave. It's also important for us to think about our children in school. If we work in a place where we have contacts with lots of people in the public that we don't know, these are all things that we need to consider in making our own adjustments. Many of the things people are already likely doing, and I know that from my own contacts and friends and family. But some, like business plans, may have to be brushed off again. And as much as we are frustrated and want it to be back to the easy way it was before this pandemic, we are going to get through this wave, and we need to rely on those tools that helped us get here. Transition to having things like your social connections, those important social connections, outside if you can, or virtual. We know that virtual connections are not anyway a replacement for being with people in person, but they are incredibly important right now, especially if we're feeling discouraged and down. And we know that there's other people out there who may be having to cocoon and because of their own risk. Reach out to a friend, reach out to a family member, whether you do that virtually or whether you do that outside. Keeping our social circle smaller if we're in those higher risk groups to 1 or 2 families. I think about some of my friends, and if you play old-timers hockey, play on 1 team, not 3 teams this season. And for kids doing extracurricular activities, we need to really make sure that we're prioritizing the essential aspects of school and perhaps limiting activities outside of school. So maybe 1 key activity rather than 3 or 4. And if you are unvaccinated, you really do need to consider your risk right now and take measures to reduce your risk of contracting this virus, because it can have dramatic effects on you. Right now, we have 3 people in ICU in this province who are unvaccinated people in their 20s, and we have 1 person in their 30s in critical care in an ICU with COVID. And that is a preventable illness. It creates a lot of distress for our healthcare workers to be caring for young people and seeing them in so much distress when it can be prevented. So again, I want to encourage people. This wave is moving quickly, and it means you need to do everything to protect yourself right now. And we know that this wave will move through quickly as well. This week, our K-12 school communities had a full return with enhanced protocols and lots of challenges in place right now. And I know from the young people in my life that it was a really positive experience for children, despite all of our fears and anxieties. And there are absolutely a lot of anxieties right now that we all have. But we recognize that, these are the best places for children to be, and it's so important for them to have those social interactions and the intellectual and physical and mental stimulation that schools give. But it is challenging times, and it will be bumpy over the next few weeks as we get through this wave. But I just want to express my gratitude to the school staff and school communities, because I know as we all work together on this and we communicate and we talk about how things are going and we make those plans, and I know that many classes, the teachers and the school staff are working with students, so they have plans in place if they have to close for a few days. But all of us are committed to making sure we can give children the best stable environment over the next few weeks that we can, and that will remain flexible and adaptable as we have through this. And I know it won't be perfect, but we will get through this, and we know how important it is, and it's making sure that we do everything we can to keep children in school as much as possible. I know for many people with these high rates of transmission, it can be very discouraging, and we can feel powerless despite our best efforts, despite the fact that we've done everything right. But we feel that we're powerless to keep our loved ones and ourselves safe sometimes. Others, and I can appreciate this as well, are likely feeling exhausted by this need for continued vigilance, to wearing masks, to watching where I'm going, to everything seems somewhat more difficult right now. We're all feeling like we're getting battered by wave after wave of this storm. But let's not forget, there is much that we do have control over, and there's a lot that we can do safely and happily. Today, we know much more about the virus than we knew 2 years ago or even 1 year ago, and we know now more about Omicron than we did even a week or 2 weeks ago. We know the steps we need to take to have those important social connections in a safe way, and it's different for each of us, and it's different with the people that we're having those connections with. We know that we can see family and friends, even though it might mean seeing them outside, or keeping our circles smaller, or seeing fewer people, so those who are at higher risk can remain safe. We also know that vaccines are providing a high level of protection. They're keeping people out of hospital, and they're preventing the transmission to those we're closest to. So even though you are fully vaccinated and may still get infected with Omicron, because that's what the virus does, the potential for you missing work or social connections or requiring care in hospital is just that much lower. I have spoken before about the importance of keeping our wall strong, and to do that we absolutely need to use all our layers of protection, but we also need to think about our mental, emotional, and physical well-being. And I encourage everyone to find the optimism and hope that does exist in all of us, and share that with those around you. Celebrate your child's school success and the happiness that they have being around their friends and their teachers in the school community. We all know the joy that comes from giving back. So take a day to volunteer in your community, to reach out, as we've done so many times over these past 2 years, to your neighbor who may need some help getting groceries in this weather, or may need some help with shoveling their driveway. We all need to be physically active, and going for a walk with a friend is a great way to do that, or finding ways to connect online and do a circuit class, as I do. These may be different approaches than what we've done before or what we want to do right now, but that's okay. We have proven our adaptability and our resilience, and we'll get through this wave too. We will get through this storm and this surge with kindness and by being calm and staying safe. Thank you.
Thank you very much, Dr. Henry. And today I'll be providing an update on surgical postponements, rapid tests, healthcare workers away due to sickness, and BC's booster rollout. I'd say our really exceptional vaccination campaign will be reaching by the end of this week 10 million doses administered across the province, COVID-19 vaccine doses since the beginning of our vaccination campaign, which is simply an exceptional achievement by our healthcare workers and by our volunteers, by people in BC. 4,426,451 first doses, 4,146,540 second doses, and as of today, last night, 1,239,995 third doses. With respect to the booster campaign, we have sent over 2 million booster or third dose invites since October 27th. Approximately 52.6% of the eligible population, which remember is those who've received their second doses, so that 4.1 million. 1.24 million boosters, as I just noted, have been given at the end of day yesterday. Since December 31st, when we announced the accelerated booster program, we have invited 870,000 British Columbians to get their shot, including over 500,000 last week. All individuals who were beyond 6 months from their dose 2 have now received their invite, and the Get Vaccinated system will be inviting individuals on a daily basis as they become eligible at 6 months or 182 days from their second dose. Over the last 24 hours, we have had 64,000 bookings, 86% online, and 14% by phone through the call center. As of today, 700 pharmacies are already participating in the BC COVID-19 vaccination program, offering booster vaccinations across the province, and 200 more are going to be starting this week. Last week, pharmacies delivered 95,000 vaccinations of the more than 314,000 vaccinations over the last 7 days. As I say, more pharmacies continue to be added, bringing the total to approximately 1,000 pharmacies across BC by the end of January. There are, as of today, 445,000 appointments open across the province of BC. That's as of this morning. And capacity is growing on a daily basis. Yesterday, for example, more than 80,000 appointments were added to the program across the province. Newly added appointments are in both pharmacies and health authority clinics. Anyone who has booked can continue to go back online and try to move up their booking if they wish, as capacity is coming on stream every day. I want to thank everybody involved in this exceptional effort across our public healthcare system and in community pharmacy. Together, they are doing simply an exceptional job, and all of us, I think, are grateful, not just what's happened in the last number of weeks, what's happened since December of 2020 when our vaccination campaign began. I wanted to update you on rapid tests. We continue to receive and distribute rapid tests based on greatest need. To date, BC has received a total of 4,850,447 rapid tests and deployed 2,853,595 of these tests to key strategic areas. That leaves a current inventory of 1,996,852 tests, of which 959,000 tests just arrived yesterday. So that's those that arrived just yesterday and are being deployed, which I'll get to shortly. 561,672 of the current inventory are not suitable for takeaway or personal use. They require special equipment, administration by trained healthcare professionals, and cannot be broken down or repackaged for self-administration. These tests will continue to be used at the discretion of medical health officers in the appropriate settings to manage clusters and outbreaks. That leaves 1,435,180 tests that are more suitable for self-administered use. Of these, as I said, 959,000 arrived yesterday. 90,000 were immediately deployed to acute care facilities for testing of symptomatic healthcare workers. 90,000 are in the process of being repackaged and distributed to testing sites across BC to replenish their supply. 200,000 are being prepared to support testing of symptomatic staff in the K-12 education sector across the province. And over 100,000 will be deployed for use by businesses and organizations in the point-of-care screening program. The balance will be repackaged and allocated over the week ahead, consistent with the plan that was outlined in detail on December 21st, 2021. An additional 841,400 tests are expected to arrive late this week or into next week. We will continue to provide detailed updates for the public on the deployment and use of rapid tests as we receive supply from the federal government. I want to just note with respect to healthcare capacity, which we regularly report on, this is the overall capacity of the system and how many patients we have on a given day. As of this morning, as you'll note, there are 9,229 base beds across the system. The complex care beds we talk about are in that number. Of those 9,229, 8,821 currently have patients. That's 95.6%. In addition, we have 2,353 surge beds. At the moment, 580 of those have patients in them for 24.9%. With respect to critical care, as you know, we have a base number of 510, and 448 of those beds are currently filled with patients. That's 87.2%. And we also have 218 critical care surge beds. 16 of those are currently in use, or 7.3%. We are also closely monitoring sickness levels across health services, especially in hospitals, long-term care, and home support. The numbers I've described in acute care show a system that is operating to an extraordinary degree. Immunization, testing, acute care hospitals above base bed capacity, which is significant, home care, long-term care, all of the things that are happening in virtual care, all of the work being done by public health. And obviously this is affected by an Omicron variant of concern that's affecting people in large numbers across the province. All health authorities are in the process of updating their contingency plans to ensure people in BC continue to receive quality, critical, or urgent care when they need it. I'll keep you informed as services continue to be impacted in these areas over the days and weeks to come. I can report that from January 3rd to 9th, there were approximately 27,937 shifts that care workers across BC, across all sectors, called in sick to due to short-term illness. This could be due to COVID-19, due to experience symptoms of COVID-19, or due to other illnesses. Just to be clear, that's the total number. They are shifts. So if you're away for a week, that's 5 shifts in one person. So it's not 27,000 healthcare workers. By health authority, that's 4,939 in the Vancouver Island Health Authority, 4,713 in Interior Health, 7,151 in Fraser Health, 1,308 in Northern Health, 5,183 in Vancouver Coastal Health, 3,138 in the PHSA, which includes the BC Emergency Health Services or the ambulance service, and 1,460 in Providence Healthcare. As I say, this number reflects the total number of shifts and may include the same employee over multiple shifts for any shift length. Of note, we are also looking, and will be securing additional space capacity for a field hospital in the Lower Mainland, including potentially converting the space we are using right now for the mass vaccination clinic at the Convention Centre, and could have a hospital set up in 5 to 7 days. Those discussions are underway, but I want to be clear, and I'll say it twice to be clear, that we are not moving to stand up a field hospital this time. We are not moving to stand up a field hospital this time. But of course, we want to have all of the options available as we go through these difficult weeks. And now here's our weekly surgical renewal update. Health authorities reported for the week of December 12th to 19th, 6,871 surgeries were completed. And while that's 168 fewer surgeries in the same week pre-pandemic, it's still, I think, under the circumstances that we're dealing with that week, an extraordinary achievement. Well, urgent and emergent surgeries are continuing around the province from January 2nd to 8th, and you see the effect of the decisions that were taken before Christmas in December. Health authorities postponed 530 non-urgent scheduled surgeries. That's 75 in Fraser Health, 35 in Vancouver Coastal Health, 3 in Northern Health, 162 in Interior Health, 234 in Island Health, and 21 in the Provincial Health Services Authority. Cumulatively, from September 5th to January 8th, 2021 to January 8th, 2022, there have been 4,278 surgical postponements due to regional surges of COVID and other factors, including severe weather patterns. Last week, I said that no patient wants to receive a call. In fact, we've said this throughout the pandemic. No patient wants to receive a call saying that their surgery has been postponed. We know that patients are anxious to get their surgery, just as we are anxious to deliver that surgery and allow them to move on from it. They want to put their surgery behind them, and so do we. We also know that no one in healthcare, no member of any surgical team, no one who has trained and whose life's work it is to get patients the surgery they need, wants to call a patient to tell them that their surgery is postponed. And this week we know that is now happening in significant numbers across BC, as I've just reported. And it's happening because of COVID-19. We also know this. When we say we will get patients the surgery they need, we deliver. Of the 14,842 patients whose surgeries were postponed from March to May 2020, 99.6% of patients have had their surgeries. Of the 3,321 patients whose surgeries were postponed from October 2020 to January 2021, and from March to June of 2021, 92% of those patients have had their surgeries. Surgeries that are postponed will be rebooked. Patients will get the surgeries they need, but we can only get to that moment through our efforts in each moment, and the difference we make in them. Adhering to public health orders, following the latest guidance, using our COVID sense, getting our vaccinations and our booster doses when invited, and making sure our children are protected with theirs. By focusing on what we can do, we can assist our healthcare system in this most difficult of moments. Our efforts will help stop the spread of COVID and slow its current surge. Our efforts will keep our children in school where they absolutely need to be. And our efforts will help patients get the surgeries they need. And with that, we're happy to take your questions.